Yeah, so Logan, as I was saying, it can be helpful for us to kind of understand what's going on in our brain and to be able to maybe state that that is anxiety that we're feeling and put a name to it, because then that'll help us know what can we do with that? How can we use treatment or intervention and make it so that we feel more at peace when our parents are not around or in different situations. What questions or concerns do you have so far?
I want to learn more about my brain. That
Yeah.
sounds really cool.
Yeah,
Our brains are amazing.
your brain is amazing, amazing. And it's so flexible and capable of change and capable of thinking of things in new ways. Um, and so I'm curious if you're willing to kind of talk about some of the best interventions for kind of what you're experiencing or things that I've found in my research.
I guess I don't know what interventions mean, but I mean, yeah, whatever you're the adult, so you know what you're talking about.
Yeah. Well, first, I want to say that yes, I'm going to talk about when I say interventions, I mean maybe some skills or activities or conversations we'll have to help lessen those anxious feelings you're having. And I also want to stress that you have autonomy. And so, yes, although we are consulting your parents because you are a minor, we also want to take into account how you're feeling because you know yourself best. You know your body, you know how it feels to be you, and we want to make sure that you feel good in your body, okay?
Okay. Okay. So is this just for me? My parents aren't going to be in here? Like, what are you going to share with my parents? Uh, Like, yeah.
Yeah,
Yeah.
absolutely. That is a super valid thing. So I will say in here, we practice confidentiality. So what you share with me is going to stay in between us, and we are going to have conversations about whatever is going to help you get to a place of feeling at peace. With that being said, I am this big fancy word that's called a mandated reporter. And so that basically means that if you tell me that you have thoughts about hurting yourself or hurting other people, then I have an obligation out of care for you and out of your safety to report that. And then from there, we would make steps to make sure that your safety is prioritized and that your safety is our top priority. Okay? Does that make any
Okay.
sense?
Yeah, that makes sense.
Yeah.
Um, so I can tell you anything I want.
Yeah. Yeah, you can tell me anything you want, but our goal here is to talk about maybe the things that are troubling you. So as much as I want to hear maybe about your favorite ice cream flavors or things like that, I also think that in order to get the best results that we possibly can, we also got to talk about some of the harder stuff too, which I know is not super fun, but it'll pay off, okay?
It's really hard for me to talk about the scary stuff. Like it makes me want to cry, and it's really hard to talk about.
Absolutely. Well, it's okay to cry here. We have tissues. And also, um, there's different interventions that I think might be applicable to you, given what you've told me, and I want to hear your perspective on it because I want to make sure that you're comfortable in this space too, because if things are already hard to talk about, which totally makes sense, I want to make sure that our next steps make it so that it's more comfortable to talk about and not less comfortable, okay?
Okay.
Okay.
Yeah.
Yeah. Well, first, I see that you've been to psychotherapy before with your parents. Can you just give me in a few words what that experience was like for you. Was it positive, negative? Any thoughts?
Yeah, it was good. We got to go talk. We usually played a game while we were talking, and would just talk about what was going on in life. Um, they wanted me to talk about things that worried me, but I feel like they asked my parents a lot of questions about what they thought worried me, or they asked my parents about how like what was going on with them. It seemed more focused on my parents and what they didn't like and what they wanted and different things like that.
Sure. Sure. Yeah. Thank you for sharing that. It's very insightful for me as I um, help collaborate with you and figure out what next steps will look like for us. Um, the intervention, once again, that big word that I'm thinking might be applicable to you, is called CBT or cognitive behavioral therapy. Once again, lots of big words, but it's kind of going to be similar to what you just described, where I'll be checking in on you on kind of what's giving you the most anxiety within the last week or 2 weeks. And we're gonna kind of break down that situation and see what different perspectives we can look at the situation through. Um, and then we're gonna look at making some goals, and that's something we can develop together. And I know last week you were talking about that you're a very driven student, so I think goal setting is maybe something that might be familiar to you, and will hopefully not be super foreign or new as we're trying to figure out what's going to help and work. Um, what questions do you have about cognitive behavioral therapy? I know it's a big thing, but yeah, what are your thoughts?
Well, what does cognitive mean? Like I know what behavior is,
Yeah,
and I know, and this is therapy, but what's cognitive mean?
yeah. That's a great question. So, cognitive, kind of going back to what we talked about, that's all the stuff that's happening in your mind. So, that's like your thoughts, that's things you dwell on, that's your values. It's all the stuff that's up here. And cognitive behavioral therapy, like you said, behavior, really focuses on kind of that connection between our thoughts and our actions. So, what we think and what we do, which I know you made the very insightful, um, you made the very insightful connection in our last visit that you think your headaches and your stomach aches have to do with your anxiety, which that's something that is, like I said, very wise and very insightful. And that's kind of what we are going to be breaking down if we choose to take this route. We're going to be thinking, okay, what are the things that you're doing or the things that you're experiencing, like an increased heart rate? How is that connected to maybe your feelings of fear or things like that? And then what are we going to do with those feelings when we do feel them? Yeah. Does that make
Okay.
sense?
Mm-hmm. Mm-hmm.
Okay.
So it's connected to that other word that you talked about a little, or amygdala or whatever.
Yes, absolutely.
Okay.
Absolutely. And we'll talk more about that guy in the future too. Um, yeah, and what that'll look like because you said that you're interested kind of in more the brain side of things and maybe some of the chemicals in our brain and all of that. Um, Yeah. So I just want to ask as we close out, um, what's kind of your general feeling around this? I know some people have maybe different like cultural or family or faith beliefs that maybe kind of um, make them nervous to go to therapy, or maybe those things encourage them to go to therapy. So I'm just curious kind of what your thoughts are on starting CBT.
Like you said, I've done this before. So,
Okay.
like, my parents believe that this will work. And like I know that my aunt has gone to therapy and things like that. So like therapy is I know is a thing that we can use in order to make our lives better.
Yeah, that's a great way to sum it up. Therapy is something we can use to make our lives better, and that's what we are hoping for. And so next week, I'm thinking we test the waters with CBT. Once again, this is a collaboration. So that's me and you working together. And so next week, I'm going to kind of give us some activities, maybe a game like you mentioned, that's going to kind of open us up to what CBT is. And then from there, we can decide if we want to keep going that route or maybe reassess. Um, I just ask that within this next week, you kind of think about any specific concerns you might have or things, questions you have for me, because we want to clear those up because we want you to be comfortable, like I said, in this space. So, yeah. Does that feel like something you can do in the next week?
Can you tell me that again? Sorry.
Yeah. Can you in this next week think about any questions or concerns you might have with
Okay.
starting therapy?
Okay.
Because
Yeah.
it can feel like a big thing. So we want to make sure it feels manageable, okay?
Okay. Yeah.
Okay,
I will think of questions and concerns about going to therapy so that we can talk about them next time. Okay.
perfect. Awesome. All right. Well, I hope this next week, your school week goes well. Um, And you can always remember the amygdala and think about the amygdala when you're having anxious thoughts, okay?
Thank you. Yeah, I will.
Alrighty, have a good week, Logan. I'll see ya.
You too.
Bye.
Bye.